being misdiagnosed for 4 years with what turned out to be Lyme disease. Now, this isn't a book just for people with Lyme disease, but it's more about how in a very complicated medical system, it's very easy for people to fall through the cracks. Every time I've given a talk, I gave a talk yesterday to a bunch of cancer survivors at Baylor, and people all have their own stories about how they were dismissed by their doctors for years with some problems. We know, I hope if anyone here is in the medical profession will excuse me, but nowadays you're lucky if you get 10 minutes with your doctor. And you're lucky now with electronic medical records that if your doctor's even looking at you, because I've got a great cardiologist, but often I'm sitting on the table because they're trying to get the record out because it's mandatory, at least in Duke, that you have to hand the patient before they leave a copy of the record. So, so I'm there waving, like I'm here, I'm just typing away. And so, so part of the story is that people who don't advocate for themselves can easily fall between the cracks and have major medical mistakes. My issue was that I knew all the right things to say. I started having, so I trained at Harvard, I was in Boston, my wife and I moved from Boston to the University of Miami, primarily because she told me she wanted to deal with another winter in Boston. And so within several months, actually within several weeks of moving to South Florida, I started having very bizarre symptoms. I had always been healthy. I'd run 2 Boston marathons. I used to run 10 miles a day, 6 days a week. Never smoked. Drank my obligatory red wine for dinner for health purposes only. No family history of anything. And then within several weeks of moving to Miami, started having palpitations. Normal heart rate's about 72. Every once in a while, my heart rate, for reasons that are completely unknown, would race to about 200 beats a minute. It passed anywhere from 40 seconds to a minute. By the time, and I knew as a physician there was something wrong. It wasn't just, oh, I watched a scary movie. They could come on when I'm sleeping, watching some, there was no cause, effect. But every time I get to the emergency room, my heart rate would normalize, my blood tests were all normal, and I was told the same thing: you're stressed, you're writing grants. At that time, you're trying to start a family, you just moved from Boston to South Florida, there's a cultural adjustment, blah, blah, blah. And so we don't think there's anything wrong with you, you're stressed. And I used to tell them, I know what stress is. I worked at Parkland with 40 days of hours being restricted for clinicians. I worked 130 hours a week in the ICU in the old Parkland. That's real stress. So, and I never had any of the symptoms that I was experiencing back in the day when I was sleep deprived and everything else. And so this went on for 4 years. I continued to have these palpitations. I was told I needed to go to biofeedback, to meditate, all of which I did, which were great, but didn't do anything for me. I was severely fatigued. Now, I still see cancer patients. When you mention the word fatigue, sometimes people say, yeah, I didn't really feel like going for a run today. I think I'm a little fatigued. It's not the fatigue that people with Lyme disease or cancer or other chronic illnesses feel. I mean, I barely could walk 20 yards without having to stop. So I went from running, 50, 60 miles a week to barely being able to walk 20 yards without having to sit. And literally feel like I needed to get my energy out. And so that is profound. That is debilitating to see. And that's what people with Lyme disease and other diseases like this experience. And millions of people experience. People with chronic fatigue syndrome, which we still don't have an answer for. People completely debilitated. But because there's no good test, they're often dismissed as being malingerers, as being depressed, as being, in the case of chronic fatigue, middle class women who have nothing better to think about than more tired. Yet I know women who are in wheelchairs who are prolific lawyers and artists who can't function anymore because they have chronic fatigue, which supposedly does exist. So anyway, so 4 years I went on with this fatigue. I had episodes, for those of you who may have Lyme disease, I had an episode of brain fog, where I described it as if I were taking 30 Benadryl tablets every few hours. I mean, I was working, seeing patients, taking care of very sick patients, but I felt like I was seeing through this haze, and it just came on incredible. It came on mysteriously. Like one morning I woke up and I just couldn't think straight. And I went to again, all the lab tests were normal. They did spinal taps, they were normal. And then again, you must be depressed. These are all symptoms of depression and stress. And then that lifted. And so for 4 years, I literally fought with my doctor saying there's something wrong. You know, maybe it's Lyme disease. Now, this was in Florida, probably the same thing here in Texas. We don't have Lyme disease in Florida.
Yeah.
So, you know, I lived in New England. Well, we don't really know about it. So finally, after 4 years, I developed a very persistently slow heart rate, 38 beats a minute, which may be normal for marathon runners, but wasn't normal for someone who's completely deconditioned. And it turns out I had what's called third-degree heart failure, meaning the electrical wiring in my heart was completely screwed up. And the impulse that normally goes from the atrium, the upper chambers of the heart, to the lower, was disconnected, and I needed a pacemaker. And the episodes that I had thousands of, those palpitations, periodically turned out to be something called ventricular tachycardia, which is a potentially life-threatening arrhythmia. So any number of those episodes could have easily killed me during that time period. And so I had a defibrillator pacemaker put in, and I still wasn't, I said to my patient, I've got Lyme disease, I know you have Lyme disease. You've got idiopathic heart failure. Now I don't know if you know the definition of idiopathic, but it really means you've got a condition for which we don't know the answer.
Mm-hmm.
Now, a good friend of mine who is an oncologist in Boston reminded me of what idiopathic really means. It really means idiot doctor, pathetic patient. I'm a physician, I can say that. So idiopathic tend not to do well because there's no treatment. So I went on, I said, I don't think I have idiopathic anything. I have Lyme disease. Well, 4 years into the whole thing, I actually developed arthritis for the first time. Like severe, huge swollen joints, hot joints, out of the blue. And I was prescribed for a completely independent reason, doxycycline. Completely independent of the arthritis. And within 24 hours, the arthritis resolved 100%. So I said, okay, third-degree heart block, which is a classic sign of severe Lyme disease, arthritis that responds to doxycycline, brain fog, extreme fatigue. I had lost 20 pounds, and I wasn't someone who needed to lose 20 pounds. I clearly have Lyme disease, and even with that, and I called the big centers in the Northeast at the time, Yale, Tufts. They all said on the phone, you don't have Lyme disease. You have idiopathic inflammation in your body.
What a joke.
And so I literally had to force my doctors, who were very compassionate friends of mine at the university, to repeat the testing. The testing, which I might add, is horrendous. You know, I do molecular biology, and in 2016, we still had the same lousy test for Lyme disease that we had 20 years ago, which is all based on an immune response. And we know that everybody doesn't respond the same way. And so after the third round of repeated testing, it finally came back positive, and I finally was treated. And most of my symptoms resolved. So the fatigue resolved. I had other signs, which some of you may have Bartonella, which is another bad infection that you could get from people. Anyone who likes feral cats needs to avoid cats. You get it from fleas on cats. You get it from, if you ride horses, you get it from horse flies. You can get it from 5 different insects. I had the burning sensation in my feet. It was so bad I had to sleep with my legs propped up because my heels could not touch any surface. I was told that was stress as well. So here I'm a physician scientist. I know there's something physiologically wrong, yet I was dismissed. So all of that resolved with, I received 3 months of, I had a PICC line put in. I received ceftriaxone. I used to sit there in the chemo room next to my patients. They would look straight ahead at their TV set, I'd look at mine, and none of us wanted to talk. I never told my patients how sick I was.
Wow.
And then the last month I received high doses of oral Biaxin. And then like I said, everything resolved, but the heart damage was done. And I make the analogy that the cousin of Lyme disease, which is spirochete, is syphilis. Syphilis, we know if you get to the end stages of syphilis, causes damage to the brain, to the heart. They're not reversible. You can get treated, you can prevent progression, but they don't reverse. So the challenge with a lot of people with this disease, and I've talked to people who probably have Lyme disease for a decade or longer, is that the earlier you recognize it, the earlier you're treated, just like anything else. Like cancer, the earlier you detect it, the earlier you're treated, the better you are. The likelihood you're going to be cured, which is why there's some information. So I was treated, the heart problems, I was left with an ejection fraction, for those of you who are medically related, of 10% ejection fraction, which is like driving normal is 55% or above. So I make the analogy, it's like driving a 6-cylinder car and having one cylinder that's working. I was told in 1998 that I needed a heart transplant immediately, and I lived the next 11 years with 10% ejection fraction, coaching my daughter's soccer team, developing 2 cancer drugs, traveling the world, getting defibrillated along the way. All of this is written in the book. It's a very visceral story. I describe what it feels like to be electrocuted from inside your body, which is something I wouldn't wish on my worst enemy. Actually, I don't know if you want me to read some. I have some. I'm sorry that you're standing here.
No, we like it.
Take turns and sit in the chair.
We're enjoying this.
So I'll take you through just some of the stages, just give you a flavor. I've been told this book took 15 years to write, partly because I'm still doing my research, and I used to write at like 3 in the morning. And the other thing is it's very different writing a book than writing research papers. So it was a whole different style. I started out writing like, War and Peace, like I have to have chapters that are 500 pages. And then somebody said, no, you want chapters that are like 5 pages, so people don't get bored with it. And you don't want to tell the whole story in one chapter because you want people to read the rest. So I'm just going to start with my Parkland days, because those of you who, since you live in Dallas, this will give you an appreciation for what it used to be like. There were weeks when I would log at least 120 hours of time in the hospital. What we endured was brutal. After work, I went running to relieve stress, clocking at least 20 miles most weeks. We spent so many hours in the hospital, it became our de facto social network. The close bonds that developed among medicine residents and the other healthcare providers in the hospital was life-saving. We sensed we were all in it together. Near the completion of my internship, the first year of medical residency, I was working in the medical ICU one night, a unit in Parkland where only the sickest of the sick were admitted. Patients admitted to the MICU required exquisite attention to every detail of their cases, or they would likely die. They were that critically ill. Some mornings, you started to feel that funny buzzing in your head if you hadn't slept all night. And one such morning at 4 a.m., and the emergency room called me to pick up my next patient. I'd lost count of the admissions from the previous day and night. The patient had to be terribly sick, otherwise the residents would have held her over for the next day's ICU team that arrived at 6 a.m. When I walked into the ER, I saw a middle-aged woman who had already been intubated and placed on a ventilator. The blood pressure was barely detectable despite the powerful medications flowing through her IV. She was an alcoholic with probable end-stage liver disease. Her body was shutting down organ by organ, and she was all mine. I'd not had a wink of sleep in almost 24 hours. I remember feeling resentful that someone could neglect herself so badly and deprive me of the only opportunity to get an hour or 2 of desperately needed sleep. As selfish as that sounds, that's exactly what was going through my mind at the time. Nevertheless, we brought her to the ICU and we started working on it. The pH in her blood, an indicator of the acid-base balance in her body, was so low it was as if she had acid flowing through her veins. She never really stood a chance from the outset. She died shortly after being admitted. I went to the family waiting room, expecting to find it empty. I couldn't imagine who would be there for this woman. As it turned out, there was one person waiting, a young girl, no more than 10 years of age.
Oh.
She sat alone, shivering with fear. There were no social workers or priests in the hospital at that hour. I sat down with this fragile child. The woman who had died was her mother. I asked about other relatives, but she shook her head no. Then I told this girl that her mother would not be coming home. As the child wept, I sat with her. I was sleep deprived and had patients to attend to, but I wasn't going to leave her alone. I'm so sorry for your loss, I said. The girl said nothing. I didn't know what else to say. We sat together in silence, waiting for the sun to rise and the social workers to arrive. So that episode actually sort of changed my life. That was my several years at Parkland. because at that time Parkland really was the indigent hospital for Dallas. There wasn't sort of the nice new buildings this was 1985, I guess. And so night after night we would get people sleeping under the bridges who would come in completely neglected. And again, we used to stay awake 36 hours straight, and you sort of lost track that these were human beings who had children and parents and loved ones. And as bad as they neglected their body, they were still loved. It really, it wasn't like I was a jerk to begin with, but it really transformed the way I thought about medicine and reminded me of why we were doing this, which was not for ourselves, but was really to help, whether this woman was an end-stage alcoholic, an IV drug abuser, or whatever. Then I'm just going to flash forward to some of the bizarre episodes that I had. Again, a marathon runner, 10 miles a day, and then experiencing this. We left, that was my wife and I, we left Harvard's Dana-Farber Cancer Institute in Boston in 1993 after I accepted a faculty position 1,500 miles south at the Sylvester Comprehensive Cancer Center at the University of Miami School of Medicine. Change can be a positive experience, but it's stressful nonetheless, particularly when it involves leaving behind close friends and familiar surroundings. Working and living in Miami was completely different from Boston. It was culture shock after having lived in Boston for 8 years to suddenly become immersed in the Latin flair of South Florida. Shortly after moving to Miami, I began experiencing episodes when my heart would suddenly, and for no apparent reason, start beating very fast. The symptoms were vague and insidious at first and made it difficult to discern when they actually started. These episodes lasted less than a minute, and everything seemed fine afterwards. My doctors, and I had outstanding ones, could find nothing wrong with me and didn't seem surprised by the heart palpitations. Stress became the most obvious and convenient scapegoat, since I had several potential stress-producing factors in my life at the time. They believed that anxiety of adjusting to a new job in a new city was the most likely culprit. Each of my episodes was frightening at the time, but the fact that they were short-lived and completely reversible initially made me believe it probably was not serious. They could not have been more wrong. One evening in 1994, Denise, who's my wife, and I were driving home like any other evening. We were talking about how much we missed our friends in Boston. I suddenly felt an unfamiliar tightness in my chest, which rapidly escalated to feelings as if an elephant were sitting on me. The pain then began to radiate up my neck and jaw. This isn't stress. I'm having a heart attack, I thought. Denise had changed the subject and was busy telling me about her day, when she suddenly noticed that I was sweating profusely. My heart was now racing, my entire body felt overheated, as if I had just run 10 miles at a fast clip. My blue shirt was soaked in sweat. Honey, what's wrong, Denise? That's putting her hand on my shoulder. So my wife, by the way, is also in the medical profession. She's an angel nurse. As I described what I was feeling, it was obvious to both of us that I was experiencing every textbook symptom of a heart attack. If that was not bad enough, I was driving 70 miles an hour on I-95, the busiest interstate in South Florida, which is stressful enough in Dade County. I felt an overwhelming sense that I was about to die. As I tried to maneuver through traffic and think where the closest emergency room was, my heart began beating so fast I thought it might pop out of my chest. I loosened my tie and tightened the grip on the steering wheel, all the while telling Denise how much I loved her, making her promise to tell my parents how much I loved them. I was certain I'd never see the light of day. As cars darted in and out of the lanes all around me on their commute home, my heart became so erratic that I feared that I might lose consciousness on the freeway. Somehow I managed to reach an exit near a hospital, ending up in an emergency room. By the time I was evaluated, the pain had resolved, my heart rate had slowed. I was reassured my heart was, quote, normal, unquote, and told that the terrifying episode had likely been precipitated by stress, or possibly what I had eaten. So, now, people with Lyme disease can get these cardiac, literally vasospasms, and can get these symptoms that are classic textbook heart attack, which is what I thought I was experiencing, except that everything turned out to be normal. And so, once again, I was told, you're fine, there's no problem. I'm just going to, again, I'm skirting